here with Governor Bobby Jindal of Louisiana, and we're talking health care. Governor, thanks so much for being with us.
Frank, thank you for having me. It's great to be with you.
Great, thank you. Well, health care is a very important topic in the elections this year, and there's a number of things that directly affect state legislators. So the first one would be the Medicaid expansion. The Supreme Court allows this in their decision upholding the Affordable Care Act. You've already said in Louisiana that you're not going to expand Medicaid. You want to talk about that a little bit?
Absolutely. First, the Louisiana specific facts. Our Department of Health did an analysis over the first 10 years of implementation. This is going to cost Louisiana taxpayers over $3 billion. And not only will it cost us over $3 billion, it's going to take over 100,000 Louisianians off of private insurance and put them onto Medicaid, which makes absolutely no sense. This is an administration now that's been here for 4 years, has not given the governors, not given the states the latitude we need through waivers and through flexibility to truly transform Medicaid. I'd make a couple of bigger points. I know different states are thinking through, and a lot of governors have said different things about the Medicaid expansion, even Republican governors. Many of them have said they're not expanding Medicaid, including Rick Scott in Florida and Rick Perry in Texas. Others have said they're going to wait and see what happens after the election to see if Obamacare does indeed get repealed and replaced in Congress. I think there are at least two reasons that it makes sense not to expand Medicaid. One a practical and one a philosophical. The practical one is that Medicaid is already breaking many states' budgets. States don't have as much control over Medicaid as we'd like because of federal mandates on eligibility, on burdensome eligibility and benefits requirements, and so many other policies that make Medicaid a very expensive way to deliver health care. The second is more of a philosophical disagreement. The Obama administration, I was actually in a debate with Howard Dean on a national TV show, and he described Medicaid expansion as economic development. And I think this really gets to the heart of the issue here. They really believe, the Democratic Party really believes that making more people dependent on government is a good thing. They really believe that borrowing money from China for the federal government to expand programs is economic development. That's not economic development. The best way to help the uninsured in our states is to create good paying jobs so that folks can go out there and afford their own coverage through their employer, through private sector coverage, not to make them dependent on a government-run program. So both philosophically and practically, I've got concerns that the final point of advice I'd give, especially to state legislators, is be very wary about this. Now, the federal government says we're going to pay for the first few years, but then we're going to start decreasing the federal subsidy and increasing the state share. We all have been victims at the state level of programs that start free from the federal government. Before you know it, the states are paying a greater and greater share. So, again, we did the calculations. In Louisiana, it's over $3 billion over the first 10 years of implementation. So it's not free to the state. At a time when we're cutting taxes, cutting spending, we just didn't think this was the best place to spend these dollars. What we have said is, why would we implement this when instead we can repeal Obamacare and replace it? Not arguing for the status quo. We're just saying government-run healthcare is not the best way to provide access.
Yeah, and it's a very badly run program, as you point out. It appears that most Republican governors are going with what you're saying.